If you're tired of wearing contacts or glasses, LASIK or PRK surgery may be a great solution for you.
Now people that can only see up close, which is nearsightedness, that have very large corrections, or if they're farsighted and have a lot of astigmatism, are all candidates for most LASIK procedures.
I never liked wearing glasses, so I tried contacts and that didn't work for me. So hoping that I don't have to wear them after today.
During LASIK, a thin flap is temporarily removed from the surface of the cornea so that a laser can reshape the rest of the cornea underneath. There are two types of LASIK. Bladed LASIK uses an instrument to create the flap, where bladeless uses a laser. The procedure is a simple one, lasting only a few minutes. What's it like to have it done?
You'll go in, there'll be a little device that holds the lids open. He puts a little ring on the front of the eye where you might feel a little pressure. A flap is created where you hear some noises and maybe have a little sprinkle of a water feeling on the front of the eye. The rest of the time, the patient's really just seeing a purple light show that's moving around, which is a laser light that's reshaping the eye in every little nook and cranny and smoothing that surface so that you can see better post-operatively.
The surgery was very quick, quicker than I expected, different than I expected, definitely a lot of bright lights, but I was very pleased and it wasn't painful, just felt pressure, but it was great.
If you are not a candidate for LASIK, you may be a candidate for a similar procedure. PRK corrects your vision using a laser after abrading the surface of the cornea, reshaping it without making a corneal flap. Recovery can be longer, but PRK may be a better option than LASIK for some patients.
The most common reason, however, to have the surface treatment is when you go into your eye doctor and they take a measurement to the front of your eye. If you don't have enough thickness to your cornea, there might not be enough room to do the flap plus your glasses prescription. So there's no difference in long-term visual acuity or performance, but the healing is a little faster with the flap.
Once the procedure is over, here's what to expect. Most patients experience good vision immediately after surgery. However, the full recovery time is about 2 to 3 months. Temporary glare and halos are not unusual for the first month or two, but this generally goes away.
But most patients, the next day, are legally able to drive in most states and feel pretty functional. And because there's no actual incisions through the wall of the eye, bending and lifting is all okay as well.
Surprisingly, if before the surgery about 10 minutes ago, if I did not have my glasses, I couldn't see maybe more than 6 inches in front of me. And now without my glasses, even just after minutes after the surgery, it's amazing. I can actually see everything that's in front of me, which is pretty crazy. So,
virtually all patients who undergo LASIK experience improved vision. As with any surgery, there are risks, which you should discuss with your doctor.
One of the potential risks of surgery of any kind, and probably the biggest worry you could have, is an infection in the eye.
However, this is a very rare event after LASIK.
The other probably most common thing is most patients can expect people to have a little bit of dry eye, even if it doesn't feel dry. So nothing is risk-free, but relatively speaking, laser is one of the safest outpatient procedures you can have.